Hi everyone, my name is Jijilyn and I'm doing my return demonstration. How to perform conscious and unconscious oral care. The definition of oral care, mouth care is defined as the scientific care of the teeth and mouth. The purposes of performing oral care are to keep mucosa clean, soft, moist, and intact. To keep the lips clean, soft, moist, and intact. To prevent oral infection. To remove food debris as well as dental without damaging the gum. 5. To alleviate pain, discomfort, and enhance oral intact with appetite. 6. To prevent halitosis or relieve it and refreshing the mouth. The equipment that we needed are, we have towel, Macintosh, the mid towel, the gloves, toothpaste, toothbrush, and let's assume that this is a cotton swab, tongue depressor, lip balm, kidney tray, and also cotton balls, mouthwash, and the 2 cups. Explain the procedure. Providing information foster cooperation, understanding, and participation care. Good day, ma'am. I'm Jijilyn and I'm your student caregiver for today. So, ma'am, I'm going to do your oral care.
Yes, I do.
When is your birthday, ma'am?
August 24.
Okay, thank you, ma'am. Oral care should be to keep the lips and mucosa soft, clean, intact, and moist. Cleaning the mouth and teeth of debris and dental plug should alleviate any discomfort, enhance oral intake, and prevent halitosis. Collect all the equipment required. Organization facilities, accurate skill performance. Close the window and door to maintain privacy. Perform proper hand hygiene and wear disposable gloves if possible to spread infection. Assess the client a comfortable upright position or sitting position to promote his or her comfort and safety and effectiveness of the care, including oral inspection and assessment. Inspect oral cavity. Inspect whole the oral cavity such as teeth, gums, mucosa, and tongue with the aid of gauze-padded tongue depressor. Comprehensive assessments is essential to determine individuals' need. So this is the tongue depressor. Take notes. If you find an abnormalities such as bleeding, swollen, ulcers, etc. Some client, the anemia, immune suppression, renal impairment, epilepsy, and taking steroids should be paid. Place face towel over the client chest or on the thigh with Macintosh. to prevent the clothing from sweating and not to give uncomfortable condition. And put kidney tray in hand or assist the client holding kidney tray to receive disposal surely. Instruct the client to brush the teeth. Client places a soft toothbrush at a 45 angle to the teeth. Effective is dislodging debris and dental plug from teeth and gingival margin. Client brushes beating surface of the teeth. Client clean tongue from inner to outer and avoid posterior direction. If the client cannot tolerate toothbrush or cannot be available, toothbrush from swabs or cotton balls can be used. When the client is prone to bleeding and or in pain, toothbrush is not advisable and not to remain and fluid and debris. Advise him or her not to swallow water. If needed, suction equipment is used to remove any excess, to reduce potential for infection, and ask the client to wipe mouth and around it, to make comfort and provide the well appearance. Confirm the condition of clients' teeth, gums, and tongue. Apply lubricant to lips to moisture lips and reduce risk for cracking. Petroleum. Rinse and dry toothbrush thoroughly. Dry toothbrush thoroughly. Return the proper place for personal belongings after drying up to prevent the growth of microorganisms. Replace all instruments to prepare equipment for the next procedure. Discard dirty properly and safety to maintain standard precaution. Remove gloves and wash your hands to prevent the spread of infection. Document the care and sign in the records. Documentation provides ongoing data collection and coordination of care. Giving signature maintains professional accountability. Report any findings to senior staff to provide continuity of care. That's all. Good day everyone. My name is Jijilyn and I'm doing my return demo to unconscious patient. Check the client identification and condition. Providing nurse care for the correct client with appropriate way. Explain the procedure to the client. Providing information fosters cooperation and understanding. Good day, ma'am. My name is Jijilyn and I'm your student caregiver for today. So, ma'am, can I check your wristband? And, ma'am, can you state your name and when is your birthday?
August 26.
Okay, thank you, ma'am. The mouth and teeth of food debris and dental plug should alleviate and discomfort, enhance oral intake, and prevent halitosis. Perform proper hand hygiene to prevent the spread of infection. Prepare all equipments. Collect all the required equipments and bring the articles to the bedside. Organization facilitates accurate skill performances. Prepare sodium bicarbonate solution in gallipot. Solution must be prepared each time before use to maximize their efficacy. If the client is unconscious, use plain tap water to reduce potential infection. Soak the cotton balls in sodium bicarbonate solution with artery forceps. Cleaning solution aids in removing residue on the client teeth while softening encrusted areas. Squeeze all cotton balls excess solution by artery forceps and dissecting forceps and put into another gallipot. Position the client. Place the Macintosh and towel on the neck to chest. The towel and Macintosh protected the client and bed from soakage. And also the Macintosh. Put the kidney tray over the towel and Macintosh under the chin. It facilitates drainage from the client mouth. Inspect oral cavity. Inspect hold the oral cavities such as teeth, gums, mucosa, and tongue with the aid of Gauss paddle depressor and torch. Comprehensive assessment is essential to determine individual needs. Take notes. If you find any abnormalities, which is bleeding, swollen, ulcers, etc., some clients, anemia, immunosuppression, diabetes, renal impairment, epilepsy, and taking steroid, should be paid attention to oral condition. They may have complication in oral cavity. Clean oral surface. Ask the client to open the mouth and insert the padded tongue depressor gently from the angle of mouth toward the back molar area. You never use your finger to open the client's mouth. This is the tongue paddle depressor. Ma'am, can you open your mouth? The tongue depressor assists in keeping the client's mouth open. As a reflex mechanism, the client may bite your fingers. Clean the client teeth from incisor to molar using up and down movement from gums to crown. Friction cleanses the teeth. Clean oral cavity from proximal to distal, outer to inner parts using cotton balls for each stroke. Friction cleanses the teeth. Discard used cotton balls into small kidney tray. to prevent spread of infections. Clean tongue from inner to outer aspect. Microorganisms collect and grow on tongue surface and contribute to bad breath. Rinse oral cavity. Provide tap water to gargle mouth and position kidney tray to remove to prevent spread of infection. To remove debris and make refresh. If the client cannot gargle by him or herself, rinse the areas using moistened cotton balls. Client's mouth and rinse gently with a small amount of water. Insert or suctioning, remove cleansing solution and debris. Solution that is forcibly irrigated may cause aspiration. Assist to avoid the contents into kidney tray. If the client cannot spit off, especially in the case of unconscious client, suction any solution to avoid aspiration of the solution. Confirm the condition of client teeth, gums, mucosa, and tongue to assess the efficacy of oral care and determine any abnormalities by using tongue depressor. Advise him or her not to swallow water if needed. Suction equipment is used to remove excess, to reduce potential for infection, and ask the client to wipe mouth and around it, to make comfort and provide the well appearance. I will remove this. Confirm the condition of client's teeth, gums, and tongue. Apply lubricant to lips to moisturize lips and reduce risk for cracking. That's a choice. Rinse and dry toothbrush thoroughly. Return the proper place for personal belongings after drying up to prevent the growth of microorganisms. Replace all instruments to prepare equipments for the next procedure. Discard dirty properly and safely to maintain standard precaution. Remove gloves and wash your hands to prevent the spread of infection. Document the care of sign and the records. Documentation provides ongoing data collection and coordination of care. Giving signature maintains professional accountability. Report any findings to senior staff to provide continuity of care.